Let's talk about the top 5 supplements to stop acid reflux. Even though there are plenty of medications available to treat acid reflux, many people would rather use a more natural method. We'll talk about some of the top supplements that can help reduce acid reflux symptoms. Millions of people worldwide suffer from acid reflux disease, also referred to as gastroesophageal reflux disease or GERD. It can be an excruciating and uncomfortable disease that can seriously lower your standard of living. Heartburn, food regurgitation, a burning feeling in the throat, nausea, trouble swallowing, chest pain, persistent coughing, and other symptoms are common signs of acid reflux disease. Sometimes the symptoms can be so bad that people mistakenly believe they are having a heart attack. If acid reflux is not treated, there are a number of extremely dangerous side effects that can occur in addition to the symptoms. Constant exposure to stomach acid can cause irritation and inflammation of the esophageal lining. Barrett's esophagus, a precancerous condition, and inflammation ulcers may result from this. Barrett's esophagus is a condition that affects 5% of patients with chronic GERD. It is more common in men than in women and in Caucasian Americans than in African Americans. Barrett's esophagus can progress to esophageal cancer, so if you are diagnosed with it, your doctor might suggest taking medication to treat stomach acid for the rest of your life. Esophageal strictures can also be caused by acid reflux disease. Strictures are a ring of scar tissue that cause narrowing of the food pipe leading to difficulty swallowing. If severe, this can even cause malnutrition. Contrary to popular belief, acid reflux disease is not caused by an excess of stomach acid. The lower esophageal sphincter, a muscle at the base of the esophagus, often malfunctions, allowing stomach acid to reflux back up into the esophagus. This is the most common cause of reflux. Foods that cause the sphincter to relax at the incorrect moment can exacerbate reflux. Fortunately, a number of foods and supplements can aid in improving acid reflux symptoms and helping the stomach return to its normal function. Hiatal hernia, obesity, and overweight are additional factors that contribute to acid reflux disease. Talking to the doctor about these conditions is crucial if you want to address the root of your issue. As previously discussed, there are numerous medications available to treat acid reflux disease. However, these drugs are not without side effects. Proton pump inhibitors are the most often prescribed drugs because they reduce the production of stomach acid. While it doesn't address the underlying cause of the problem, this can help reduce the symptoms of acid reflux. Resolving the underlying cause of the issue and avoiding pharmaceutical side effects are two advantages of choosing a more natural solution. Let's find out which supplements are best for relieving acid reflux symptoms. First though, I kindly ask you to like the video and subscribe to this channel. It is very important for us. Thank you very much. Apple cider vinegar is the fifth supplement. Apple cider vinegar has a long history. The Babylonians utilized it as a preservative, and the Egyptians utilized it as a medicine. It was used as a home cure for a number of illnesses in the early days of America, including indigestion, colds, and even tuberculosis. But as a health supplement, apple cider vinegar didn't become widely accepted until the 1950s. The natural sugars in crushed apples are fermented with bacteria and yeast to produce acetic acid, which gives this supplement its sour flavor. Given its acidic nature, apple cider vinegar may seem like a strange supplement for acid reflux, but many people find that it relieves their reflux. This is how it's beneficial. The stomach needs a high acid content, low pH level, in order to function properly. This high acidity is necessary for the stomach to break down food and speed up the digestive process. Apple cider vinegar can help reduce acid reflux by bringing the stomach's acid levels back to normal. You can try taking 1 tablespoon of apple cider vinegar in a glass of water as a supplement. Check to see if this mixture helps with your symptoms by drinking it 5 minutes before eating. It is important to dilute apple cider vinegar with water before taking it, as this could erode your teeth's enamel. Apart from its digestive properties, apple cider vinegar also helps to break up kidney stones, control blood sugar, and strengthen the immune system. If you have gastritis or an open ulcer, you should avoid taking apple cider vinegar because the acid may irritate your stomach. Probiotics come in 4th place. Probiotics are live microorganisms that are present in some foods and supplements. Because they support a healthy balance of bacteria in the gut, they are also referred to as good or friendly bacteria. Probiotics come in a variety of strains, each with special advantages of their own. Two of the most popular strains are Lactobacillus and Bifidobacterium. Numerous fermented foods, including yogurt, kefir, sauerkraut, kimchi, and kombucha, contain these strains. Acid reflux may be avoided by taking probiotics, which will help keep the good balance of bacteria in your digestive system. Probiotics may particularly aid in easing the symptoms of acid reflux disease, according to research. In 2020, a review of 13 studies on the effects of probiotics on acid reflux was published in the journal Nutrients. The analysis found that probiotics were useful in treating symptoms of reflux, including heartburn, regurgitation, and stomach pain. Bifidobacterium bifidum, Streptococcus thermophilus, and Lactobacillus acidophilus are a few of the top probiotic strains for acid reflux. Eating fermented foods is one of the easiest ways to increase the amount of probiotics in your diet. Probiotics can be found in yogurt, but it's crucial to choose a brand that has live, active cultures in it. Probiotic-rich foods include kefir, sauerkraut, kimchi, and kombucha, among other fermented foods. You can also take a probiotic supplement if you're not a fan of the taste of fermented foods. These supplements are available in a variety of forms, including liquids, powders, and capsules. Selecting a superior supplement with the precise probiotic strains you seek is crucial. Ideally, it should be kept in a refrigerator to preserve the bacteria. If you have a medical condition that affects your immune system, you might want to see your doctor before taking probiotics. After purchase, keep your probiotics in the refrigerator and take them every day. Ginger comes in at number 3. We're going to look at a few of the ways that ginger can help with acid reflux today. Ginger has been used for thousands of years for its many health benefits. Herbal traditions in Asia, India, and the Arab world have long used it. For instance, ginger has been used for more than 2,000 years in China to treat nausea, diarrhea, and upset stomachs, as well as to aid in digestion. In addition, ginger has been used to treat heart problems, colic, arthritis, and diarrhea. What is ginger exactly? It's a spicy, warming root that's frequently used in cooking. Beyond just its flavor, ginger has strong medicinal qualities due to the presence of compounds like shovel and gingerol. Ginger can be eaten fresh, dried, or powdered, and it can help soothe upset stomachs and reduce inflammation. One common way to consume ginger is in ginger tea, which is said to help reduce tension and anxiety. Moreover, tinctures, tablets, and capsules containing ginger supplementation are offered. Chewing on a piece of ginger root can help ease heartburn symptoms. You could also experiment with cooking with ginger or making ginger soup or tea. 1 gram per day is the recommended dosage. In addition, ginger can act as a blood thinner, lower blood pressure, and lower blood sugar. However, if you take medication for any of these conditions, talk to your doctor before using ginger. In fact, consuming a lot of ginger might exacerbate heartburn. Beta-HCl with pepsin comes in second. This supplement combines pepsin, an enzyme that aids in protein digestion, with butane hydrochloride, a naturally occurring acid that aids in the breakdown of food in the stomach. Our bodies produce less stomach acid as we get older, which can be a serious issue. The majority of our knowledge about low stomach acid is derived from clinical research involving medications like proton pump inhibitors that lower stomach acid. Studies on these medications shed light on the dangers of low stomach acid, including the possibility of gut infections, decreased absorption of vital nutrients like calcium, magnesium, iron, and vitamin B12, and the development of diseases like anemia and osteoporosis. Food does not break down entirely and stays in the stomach for longer periods of time when stomach acid production is low. Acid reflux may result from this, as the stomach's contents may spill back into the esophagus. Pepsin and butane, HCl supplement stomach acid production, which can enhance food breakdown and lessen indigestion and acid reflux symptoms. Usually taken before meals, The dosage is lowered at first and then progressively increased until the symptoms subside. You can take 1 to 3 capsules with each meal. Stop using the supplement if, after 1 to 2 weeks, your symptoms do not improve or if you start to feel like your stomach is burning. It is crucial to remember that not everyone should use butane HCl with pepsin, especially if they have ulcers or other digestive problems. It should not be taken with antacids, which are designed to reduce the production of acid. It's best to consult your doctor before starting a new supplement on your stomach. The first supplement is called zinc L-carnosine. Zinc L-carnosine is a zinc and L-carnosine combination that has been used clinically in Japan for over 20 years and more recently in Italy. It is used to treat any gastrointestinal tract ailment that calls for mucosal preservation and repair, such as acid reflux disease. Zinc is a vital mineral required for wound healing, immunological system function, and DNA synthesis. It is especially beneficial for repairing the gastrointestinal tract's epithelial tissue. Muscle tissue contains high levels of the amino acid L-carnosine, which aids in the movement of fatty acids into cells where they are burned for energy. Supporting gastrointestinal health is one of zinc L-carnosine's most well-known advantages. Research has indicated that zinc carnosine can support the development of beneficial gut flora, lessen intestinal inflammation, and enhance the integrity of the gut lining. These advantages might lessen the symptoms of gastrointestinal conditions like inflammatory bowel disease and irritable bowel syndrome. Numerous studies have demonstrated the potential benefits of zinc L-carnosine for the treatment of acid reflux disease symptoms, including the restoration of the digestive tract's protective mucus barrier. Would you add anything to the list of beneficial supplements? Leave a comment below to inspire others with more ideas to try. Making additional dietary adjustments may help increase the effectiveness of these supplements. Cutting back on fatty meals should be the first adjustment made. What causes reflux caused by fatty foods? The lower esophageal sphincter will relax in response to fatty meals, particularly those that are fried, greasy, or oily, allowing stomach contents to reflux back into the esophagus. Unfortunately, this includes stomach acid, which burns the lining of the esophagus and causes heartburn symptoms. Cutting back on the amount of fatty foods in your diet might be one of the best things you can do. It might also be a good idea to reduce your caffeine intake. Caffeine stimulates the production of more stomach acid after consumption. For most people, this is not an issue, but for those who are prone to acid reflux, it can significantly worsen symptoms. If you enjoy drinking coffee, there have been studies that indicate that switching to decaffeinated coffee reduces symptoms. Reduce the amount of caffeine you consume each day to see if it helps, if you depend on it for focus or energy. Eliminating caffeine from our diets can be challenging, but if it can keep you off of medication, it might be worth the effort. As an alternative, you can concentrate on altering your diet or way of living to address the underlying cause of acid reflux. Let's talk about chocolate next. Like fatty foods, chocolate contains substances like theobromine and methylxanthines that relax the esophageal sphincter's muscles. But it gets worse than that. Chocolate also contains caffeine, which increases the production of stomach acid. Sadly, alcohol is very similar in that it relaxes the lower esophageal sphincter and increases stomach acid production. While alcohol and chocolate can be delicious, eliminating them completely might be the best option if reflux is severe. Eliminating carbonated drinks, such as diet sodas, carbonated water, and sodas, can also be very beneficial. Unlike the foods in our previous food group, these beverages will impact the lower esophageal sphincter in a different way. To better understand the issue, let's take a closer look at these muscles. When the sphincter is working normally, it will relax to let food enter the stomach and will also relax if the stomach is overly pressurized or contains too much air, which will result in a burp. We swallow too much air when we eat too quickly or do not chew our food thoroughly, which sets off this mechanism and eventually makes reflux worse. Carbonated drinks will put more pressure on the sphincter by causing the stomach to distend and produce more gas. If you have acid reflux, try to stay away from carbonated drinks of any kind, including carbonated water. Eat less of spicy foods like peppermint and mint, as well as acidic foods like tomatoes and citrus fruits. Let's wrap up our conversation with the lifestyle modifications that are most effective in treating heartburn. Together with the supplements we discussed, losing weight can help reflux a lot. Gaining weight increases the pressure inside our abdomen, which strains the stomach and leads to acid reflux into the esophagus. Your symptoms might be fully resolved and intra-abdominal pressure lowered if you lose weight. Avoid eating 2 to 3 hours before bed if you experience symptoms at night so that your body has time to process the food. Why is this effective? The acid in our stomachs actually has to overcome gravity to ascend into the esophagus when we stand upright. Acid moves more easily in the wrong direction when we are flat on our backs. If your symptoms still persist after you've avoided eating right before bed, you may try supporting yourself during the night by putting something under your mattress or adding more pillows. We appreciate you watching, and if you want to learn more about your health, don't forget to subscribe. Bye.